Welcome back. Today we are going to learn about the analysis of posture. This video has been prepared by Dr. Kami Pura and Dr. Paras Pura, Assistant Professor in BITS Institute of Physiotherapy, BITS Edu Campus, Varnama, Vadodara. Observational analysis of the posture in the sagittal plane involves locating body segments in relation to the line of gravity. So let us first see what do you mean by plumb line or a line. A plumb line or a line is with a weight on one end dropped from the ceiling and passing through the external auditory meatus of the ear may be used to represent the line of gravity. In this video, we are going to see about sagittal plane alignment and its analysis. As we have learned in our earlier video, the external and internal moment. So first, before understanding that external and internal moment, let us see how the line of gravity is passing in a sagittal plane. If we see the joint atlanto-occipital joint, the line of gravity will pass anterior to the atlanto-occipital joint. The line of gravity passes posterior to the cervical joint, anterior to the thoracic, posterior to the lumbar, anterior to the sacroiliac joint, posterior to the hip joint, anterior to knee and ankle. As it is much important, I am repeating again. The line of gravity will pass anterior to the atlanto-occipital, posterior to the cervical, anterior to the thoracic, posterior to the lumbar, anterior to the sacroiliac joint, posterior to the hip joint and anterior to the knee and ankle. As we have seen in earlier video, whenever the line of gravity will pass anterior to the joint, the proximal segment will rotate anteriorly. And if line of gravity will pass posteriorly, the proximal segment will rotate posteriorly. So based on that, the moment will develop. So as line of gravity is passing anterior to the atlanto-occipital joint, the external moment is developed, that is flexion moment. As line of gravity is passing posterior to the cervical, so the moment which is developed is extension. As line of gravity is passing anterior to the thoracic, so moment that has developed flexion, and so on for the lumbar, sacroiliac joint, hip, knee and ankle. Based on that, you can have a quick review of the forces, that is passive opposing force and the active opposing force. Deviations from optimal alignment in the sagittal plane. Minimizing energy expenditure and stress on supporting structures is one of the primary goals of any posture. Any change in position or malalignment of one body segment will cause change to occur in adjacent segment, as well as changes in the other segment, as the body seeks to adjust or compensate for the malalignment. These large changes from the optimal alignment will increase the stress or increase the force per unit area on the body structure. If the stresses are maintained over a long period of time, the body structures may be altered. Whenever the prolonged weight-bearing stresses on the joint surface increases, that increases the cartilage deformation, and that may interfere with the nutrition of the cartilage. As a result of it, the joint surface may become more susceptible to early degenerative changes. Postures that represent an attempt to either improve function or normalize appearance are called as compensatory postures. Let's start with the foot and toes and then we move up to the head. First start with the foot and toes. In that first deviation is claw toes. Claw toes is being characterized by hyperextension of the MTP, that is metatarsophalangeal joint, which is combined with the flexion of proximal PIP, that is interphalangeal, and distal interphalangeal joints. I am repeating again what do you mean by claw toe. Claw toe means hyperextension of MTP, which is combined with flexion of PIP as well as DIP. The abnormal distribution, because of that, there will be the abnormal distribution of weight that may result in a callus formation under the heads of the metatarsals or under the end of the distal phalanx. Sometimes the proximal phalanx may subluxate dorsally on the metatarsal head. The callus may develop on the dorsal aspect of the flexed phalanges because of constant rubbing on the inside of the shoes. This deformity reduces the area of base of support, and as a result that may increase the postural sway and decrease the stability in a standing position. There are certain etiologies which are present for these conditions are as follows. First, the restrictive effects of the shoes. Second, a cavus type of foot, muscular imbalance, ineffectiveness of the intrinsic foot muscles, neuromuscular disorders, and age-related deficiencies in the plantar structures. As you can see in the diagram, plateau means hyperextension of MTP joint and flexion of PIP as well as DIP. Second, hammer toe. Hammer toe is being characterized by hyperextension of MTP joint, flexion of PIP joint, and hyperextension of DIP joint. I am repeating again, hyperextension of MTP joint, flexion of PIP joint, and hyperextension of DIP joint. The callosities means a painless thickening of the epidermis, which may be found on the superior surface of the PIP joint over the head of the first phalanges as a result of pressure from the shoes. As we have seen, there will be the hyperextension of MTP joint. So the flexors muscles are get stretched over the MTP joint and it gets shortened over the PIP joint. As there will be the hyperextension of MTP joint, exactly the reverse will occur in regard to flexors muscles. The extensors muscles are get shortened over the MTP joint and it gets stretched over the PIP joint. If the long and short toe extensors and the lumbrical muscles are selectively paralyzed, the intrinsic and the extrinsic toe flexors acting unopposed will buckle the PIP and DIP joint and that cause a hammer toe. As you can see in the diagram, what do you mean by hammer toe? Hyperextension of MTP, flexion of PIP and again extension of the DIP. Now knee joint. In knee joint, first we'll see about flexed knee posture. We had seen that whenever in normal joint, the line of gravity is passing anterior to the knee joint and the moment, that is external moment that has been created, is external extension moment, which is opposed by internal flexion moment. Now let us see how the line of gravity is passing whenever there is a flexed knee posture. In a flexed knee posture, which can result from knee flexion contracture, the line of gravity is passing posterior to the knee joint axis. As a result of it, there will be the external flexion moment at the knee that must be balanced by an internal extension moment, which is created by the activity of quadriceps muscles in order to maintain the erect position. This increases the muscle activity in order to maintain the flexed knee posture that creates a more stress on the tibiofemoral and patellofemoral joint. And that ultimately leads to an fatigue of the quadriceps femoris and other muscles if the posture is being maintained for the prolonged period of time. This flexed knee posture also affects the other joint, that is proximal as well as the distal joint, that is hip as well as the knee joint. Let us see how this flexed knee posture affects the hip as well as the knee joint. Because of the knee flexion in an upright stance is accompanied by the hip flexion and ankle dorsiflexion, the location of line of gravity also will be altered in relation to this joint axis. At the hip, the line of gravity may pass anterior to the hip joint axis. That may create an external flexion moment. As a result, there will be the activity of hip extensors may be necessary to create an internal extensor moment to balance the external flexion moment acting around the hip. That increase the activity of soleus muscle in order to create an internal plantar flexion moment to counteract the increased external dorsiflexion moment at the ankle. Overall, the increased need of the quadriceps, gastrocnemius, soleus and perhaps hip extensors activity appears to be substantially increase the energy requirement for the stance. You all can have a quick look how the line of gravity is passing in a flexed knee posture and how the internal and external moment has been developed. Second, hyperextended knee posture, which another name is Genu Recurvatum. In this, the line of gravity is located considerably anterior to the knee joint axis. As a result, there will be the increase in the external extension moment which is acting at the knee joint. And because of that, that will put a great stress or tension on the posterior joint capsule, result in adaptive lengthening of the posterior capsule and of the cruciate ligament, and consequently it create a more unstable joint. The anterior portion of the knee joint surface will be subjected to abnormal compression and therefore are subjected to degenerative changes of the cartilaginous joint surfaces. Hyperextension at the knee is usually caused by either by limited dorsiflexion at the ankle or by a fixed plantar flexion position of the foot or ankle, which is called as equinus. Sometimes it may also be result because of the poor habits that has been formed in childhood. In this slide, we will see the deviations of pelvis and vertebral column. The first deviation is that is excessive anterior pelvic tilt. This excessive anterior pelvic tilt which may leads to an increase in the lumbar lordosis. That as a result of it, as a compensatory changes, there will be the increase in the kyphotic posture, that is excessive dorsal kyphosis, and that may ultimately ends in an excessive cervical lordosis. In this slide, you can see which are the structures that are prone to get stretched and which are the structures that are prone to get shortened. Have a quick look to it. Now let us see the deviations which takes place in head. That is, first is forward head posture. As a result of the forward head posture, there will be the increase in the cervical lordosis. And as the time changes, that may lead to a medial rotation of the scapula. Let's have a quick look of the structures which are underwent for the compressive force or distractive force and otherwise shortening or the lengthening. If you like this video, please share, comment and subscribe to our YouTube channel. In next video, we are going to learn about the analysis of posture in frontal plane. Stay tuned. Please subscribe to our YouTube channel. Learn to lead, be the best. Thank you.